Good afternoon. Thank you so much for taking out time to join this webinar. I'm Oghenefego Ofili, and I'm your host for today's webinar. I'm quite grateful that a few of us have kept time. Hopefully, as we continue, others will join in, or they will have the opportunity to watch the replay maybe on YouTube or on other platforms. So thank you again for coming in quite early. I appreciate that. Please, can you drop on the chat if you can hear me? So I'm sure that we're good with audio before I continue. If you can hear me, just say yes on the chat or in the chat room so that I just confirm that audio is good and we are good to go. Awesome. Okay, thank you. Okay. Okay, so let me share my screen and go straight into the presentation. So the reason why we're here today is because I want to share on nutrition for healthy aging. Like I shared in one of my posts, I'm quite tired of having people who are in their 50s, maybe 60s, feeling so tired, frail, weak, sickly. But being tired of something is not enough. We have to do something about it. And as a nutritionist, I thought I should share knowledge with the public on how we can ensure that as we age, we pay attention, the things we're supposed to pay attention to when it comes to our health and nutrition especially. So I do not intend for this presentation to be a very long one. I would rather we have a lot of time to ask questions and interact. So I'll go right into my presentation. Like I introduced earlier, I'm Dr. Oghenefego Ofili. I have a PhD in human nutrition and dietetics from the University of Ibadan. I'm quite passionate about public health, ensuring that people have information that will ensure that they live a healthy life and they enjoy the life they're living. So that's one of the reasons why at NutriFit we're doing this webinar. I'm the founder of NutriFit, a policy research and nutrition education organization based in Lagos, Nigeria. So now, most of the time, I've noticed that people seem to think that aging is bad, right? There's this whole not so sweet perspective or not so sweet thoughts people have about aging. They feel like, man, I'm not old though. You know, when you see somebody's old, person is just responding quickly, I'm not old though. Yeah, so in this part of the world, there's that. But aging is actually natural, and it's something that we should embrace. It's something that we should not be ashamed of. In fact, it is a gift. Aging is a gift that we should actually look forward to and prepare for. And that's why we're having a session like this, so that you prepare. You don't just allow things to happen anyhow they want, or whatever will be, but you are deliberate about how you age, okay? So it's really not about running away from aging, but ensuring that as you age gracefully. Like I said, you cannot stop yourself from aging. It's a natural process, but you can determine how you age. There are natural tendencies that will happen as you age. Our muscles, naturally, the muscle mass begins to reduce, our metabolism. So the rate at which your body is able to, or your system is able to digest and break down food and get the nutrients out, the pace begins to reduce. Sometimes digestion is now slower. Some people have issues walking. Some people have challenges with their sight. So there are natural things that happen as you age. So this session is not about you will never age, right? It's about how to prepare effectively for it, deliberately preparing as you age so that you are healthy and strong as you go along in years. And this session, really, my target are those who are not yet 65 years old. So those who are still in their late 30s, going to 40, 50, and maybe early 60s. So there's a lot you can still do at these ages I just mentioned to ensure that you have a healthy life. So some factors, three factors actually affects the rate at which we age based on research. Those three factors are, the first one, hereditary factors. So in some families, they have longevity in their genes. They live very long. You know, they say people are in that family, they live up to 90. So it's in the gene, right? There are hereditary factors. Then we also have lifestyle factors, which is the major reason why we're having this session. Lifestyle factors, things like your general lifestyle. So your diets, your nutrition, your physical fitness and activity, lifestyle, alcohol consumption, drug use, you know, different things that have to do with your lifestyle, whether you are an active worker or sedentary worker. Those are lifestyle factors that can affect the rate at which one would age. Then environmental factors. I don't know if I can close this. Yeah, that's better. Yeah, there are environmental factors. Environmental factors are factors like education, the level of education of the person. Most times your education also affects your income. So income, access to shelter. There are different, so those are environmental factors. In this, looking at the three factors that affect the rate at which you age, it is only hereditary that you cannot control. You can actually control lifestyle factors and environmental factors, right? So we have control over these two, and that's where we want to focus our attention in this session. So the things we need to pay attention to. So the first thing we need to pay attention to is family tree of illness. Yes, you've heard about what's your family tree? My grandfather, my great-grandfather, and all that. Then you draw a tree. Yeah, that kind of tree. But this time, family tree of illness. We'll dig deep later into these different points, so we should pay attention. So you need to pay attention to the family tree of illness. You need to pay attention to nutrition, physical fitness, your dental health, mental and social well-being, and then your finances. Okay, these are major factors that we need to pay attention to as we begin to age. You might be 30 years old now or 35, and you're wondering, why am I even here? The truth of the matter is that you need to start preparing now. Once the way our body is designed, from the age of 19 up to age 30, the rate at which cells are being synthesized, that's created, is equal to the rate at which the cells are also being destroyed or breaking down. Okay, so there's a balance. But once you clock 30, 31 and above, the pace begins to slow down. So you have more cells breaking down, disintegrating, than those that are being built. Okay, so whatever you do at this stage of your life is going to come to either congratulate you at old age or haunt you. But we don't want anything to haunt us. So that's why we're having a session like this. Family tree of illnesses. You know, in this part of the world, there's this whole, it is not my portion. Yeah, it's not my portion. It will never happen to me and all that. Where people of faith, we believe a lot in God and the supernatural, if I should put it that way. I'm not doubting that. but we need to pay attention to the family tree of illness in the sense that we want to know. Somebody sent a message. Okay, sorry. Yeah. So it's not about it's going to be your portion. If you do not know or you don't pay attention to the particular illness that actually affects family members, you might actually be on your way to have same illness just because you have continued to follow a particular path or a particular style of doing things that you have adopted from that family. Okay, but when you know, oh, in my family they usually have, there's always a stroke, or my great grandmother had breast cancer, and then my grandmother and all that, or my dad was always managing high blood pressure. It gives you an idea of, oh, I'm from this family, this thing could actually happen to me because it's prevalent in my family. So what do I have to do to ensure that I do not fall a victim of such illnesses or diseases? So with chronic diseases, hereditary is not necessarily destiny. And that is the point I'm trying to make here, right? It's not that, okay, because a family member, because my family members in my family tree, there's actually, can you hear me? Just checking that everybody can hear me. Yes, yeah, so I need to do that often so that, okay, so we can hear. Okay, great. Please, if at any point you can't hear me anymore, kindly drop a message on the chat group so that I'm able to pay attention to that. Yeah, so it's not your destiny that you're going to definitely, but if you do not work towards avoiding those illnesses, then most likely you might fall a victim. Now, there's something we call compression morbidity, which is, let me explain it in layman's language, right? If in a particular family, they usually have, let me say, high blood pressure, right? If in a particular family, they usually have high blood pressure, but you find out that, oh, from my family tree, they always have high blood pressure, and it starts when they are like 60 years old. Okay, so I do not want to be a part of those who are going to suffer or have to manage high blood pressure. What do I need to start eating? What do I do about my diet? What do I do about my fitness, right? My physical fitness and all, to ensure that I do not manage high blood pressure. Now, compression morbidity is that because you have identified this particular illness or disease, and you begin to do things to ensure that you do not manage or don't develop same diseases, like you now take your exercises more seriously, you cut down on sugar and all that, reduce your cholesterol level, you begin to do things that make you a healthier person. Compression morbidity states that if in your family they used to get it at 60, because you've identified this and you started working towards ensuring that you live a healthy life, you can actually shift that disease from coming to you until you are like 80. So you've given yourself like 20 extra years of living healthy without that disease or infection. I hope you're getting my point. If you don't get it, I'll repeat it again, maybe during the question and answer session. But so with compression mobility, we're saying that you can actually increase the number of healthy years you have, even if in your family there's a particular disease or infection or chronic disease that happens to, that occurs in the family, and then put it better that way. Okay, so another thing we should pay attention to is regular medical checkups, right? So if in your family tree there's breast cancer or whatever, cervical cancer, it is when you go for regular checkups that you begin to monitor, oh, what's my cholesterol level? what's happening in my cervix, right? As females, prostate cancer, what's happening? You need to go for regular checkup. That's how to pay attention to family tree of illness, right? It's not just enough for you to say it's not my portion and then you move on. Now, nutrition. Remember I mentioned that there are various factors that we need to pay attention to. One was family tree, the next nutrition, which is really the core for me. Nutrition, I know many of you've attended a lot of seminars, workshops, right, that have talked about nutrition and all that, and you have basic knowledge of nutrition. This webinar is not to give you an in-depth training on nutrition, but to let you know that as you age, you begin to pay attention to the things you eat, right? The quantity and what you really need as you age. Today, I did a post on my social media platforms where one of my professors, where I was asking him, how do I ensure that my child is not malnourished? And he made a statement that many times adults don't want to give children meat, fish, egg, and all that because they feel, what is she using it for? So that he will not have long throat, right? in Nigerian palace. So that the person will not have long throats or start stealing, right? But the children are the ones that need these things. They need protein because they are actually growing. But their body needs these nutrients more than you that is aging, that is 35 and above. Okay, so you need to eat nutrient dense foods, right? Reduce your sugar, prioritize fruits and vegetables, water. Maybe we'll have another session to really dig into this. Check your BMI. BMI is body mass index. Okay, you can do a very quick check online. If you go on Google and say BMI calculator, you can check your BMI, right? What you need to check your BMI is your height in centimeters, and then your weight in kilogram, kilogram, yeah. So once you impute it there, your age and all that, you can see it will give you a result. So whatever result you get, if it is below 18.5, that person is underweight, right? It means that the person has less body mass than less than what the person is supposed to have, right? Less than the standard. If it is between 18.5 to 24.9, it's normal and that is healthy. By the time you're moving to 25 to 29.9, person is going towards, that's overweight, and then above 30, the person is tending towards being obese. So, and we don't want to be there. We want to stay between 18.5 and 24 and 24. Hope you can still hear me, because I saw a notification about my internet. Saying something about my internet being slow. But I believe since there's no notification, I believe you can hear me. Okay, so yeah, so I'll go ahead. So yeah, check your BMI as often as you can, because it's important for you to do that. Information from, so in planning your nutrition, remember I said there's something called compression morbidity. So once you know a particular history of disease or infection or chronic disease in your family, you need to now make sure that your nutrition, whatever you're doing with your diet, actually aligns with you living a healthy life and not getting into a situation where you now have that chronic disease or illness that happens in that family tree. Okay, so yeah, use supplements to provide minerals and vitamins. Sometimes the food we eat, because of our cooking methods, the way we prepare our food, so sometimes we lose a lot of nutrients, and so the body is not getting enough supply of these nutrients. So once you begin to get to your 35 and above, it's actually advisable to get supplements to support whatever your diet is not supplying. The next place we're paying attention to is your physical fitness, right? Like I mentioned earlier, as you age, you naturally lose muscle mass, right? And to build muscle mass, and once you begin to lose muscle mass, it means that you are going to be having, the person, not you, is going to start having challenges with movement, right? People say, my body is paining me. I feel pain in my joints, my waist, my neck, my back. Okay. So it's actually advisable that you need to pay attention to physical fitness, which will help you begin to rebuild your muscle mass and help to ensure that you do not have issues, right, with movement as you age. So you don't get to a point where you can no more stand straight, or you cannot move your legs, or if you sit for so long, your knees get locked and all that. So, but we have to be deliberate about this to ensure that we begin to develop or adopt a lifestyle that makes us more active as we go along as adults. Okay. So like I said, instead of using the stairs, you can decide to instead of using the lift, you can decide to use the stairs. Walk more. Sometimes you want to go to the market or the shop just like 500 meters away, and most of us will take a bike, or sometimes in the evening you could just decide to do a walk instead of driving. Okay, so just be deliberate about some lifestyle changes that will help you stay fit and strong. Then you have to be deliberate about building muscles. So we talk about strength training. Okay, there are different types of strength training. We have the push-ups. Some people weight lifts or dumbbells, like the picture I have on my screen. That's like a plank. That's also a way to build strength, right? Your muscles. So these are some exercises that you can begin to infuse into your daily routine. So I usually advise people, because most times we have challenges with exercising. Oh, I don't have time. I'm usually very busy. Different things come up as we work and take care of our family. So that's why I mentioned use the staircase, walk more. So you deliberate about those things. And once you can start there, you don't have to say, oh, I'm going to do 10 kilometers run or jog on the first day. No, you could actually start with, say, I want to do 10,000 steps today, once a week, or one push-up a day. You don't have to do 10 push-ups, right? In this day and age of social media where everybody is sharing whatever they're doing with their fitness online, sometimes you kind of and what they call it, some people are harassing you with their exercise exploits, right? But it's important that just start as little. The most important thing is that you are consistent. So do whatever you think will make you consistent. Dental health. Dental health is very important. Unfortunately, we do not pay attention to it a lot. As people age, they begin to lose their teeth, or some teeth that are important, especially the molars, right? The ones we chew with. So to prevent this, you need to pay attention to dental check, your teeth, your oral, your dentition and all that, and ensure that you go for checkup at least once a year. One of the things that has been identified in research, as people age, they find it difficult to chew. And that's because they've really not taken care of their gums, right? Their teeth and all that over the years. And there's a lot of decay there that now makes it very difficult for them to chew. And if they can't chew, if they have issues with chewing, it means they are going to also have issues eating. And if you have issues or challenges eating, it means that your nutrition is also going to be compromised. So we need to pay attention to dental health. Mental and social well-being has become very, very important as you age. In fact, more people, most of the time, between 30 and 60, we are so busy with our careers, we're so busy with our children, So most of the time we lose contact with friends and all that. And by the time these children are gone, by the time you're retired, you now find out that, oh, I no more have friends. There are no people to gist with and all that. So it's very important that we begin to be deliberate about building long-lasting relationships, okay? So that one of the challenges that faces older people today, you do not become one of the people who faces that challenge, where there are a lot of lonely people, elderly people, they are lonely, especially those who have lost is their spouses, right? Or are now separate, living separately. They are lonely because they don't have anybody to talk to, nobody to visit. In this age and time when most of the children are in the cities, they don't even have time to visit their parents. So people get really lonely, and we need to be deliberate about building relationships as we move, as we age, okay? So that our mental health, because it's a big challenge now with the elderly, where there's a lot of depression, anxiety, sadness among the older people, because there's no real social system for them to enjoy such relationships that they had before. So we need to build this. We need to volunteer more. If you can, be active in your community. Some of us will go to church, be active. That's how you build relationships. You can also build relationship with a younger generation. Okay, you don't have to build only with your age mates, right? It's also very good to have friends that are younger, so that you also tap from their knowledge and you don't feel lost in their own generation, right? Those of us that are millennials, in fact, my target group are millennials. So, right, begin to have friends that are Gen Z, so that, and then the Gen Alpha, right, the younger ones, so that you don't lose touch of what's happening in the world and you still feel that excitement and energy. Enjoy the outdoors, go out, travel, prioritize rest. Stress is a killer. So a lot of people are dying because they're really stressed out and they don't have any, we just focus on our careers and whatever we're doing. And it's like there's no social, social life, right? Laugh, play, and live, okay? Our mental health is very important and we need to pay attention to it as we grow older. Now, our finances are also very important. When I mentioned environmental factors, right? At the beginning, I said something about the factors that affect the rate at which people age, and one of the factors was environmental factors. Finances is under environmental factors. We need to plan for old age, right? You need to be sure that you are good with your finances. You can take care of yourself when you are old. If there are medications you need to get, you have a roof over your head. Um, if you need to travel, there are things that we need to take care of as we are still strong and healthy, to ensure that we have a healthy and interesting uh, older years. I put it that way. So start investing now. For those of us who have jobs that give us pension, that's great. If you don't have that, if you're a business person, look for a way to have a plan for your retirement, okay? Um, I've heard a lot of parents say their children are their retirement plan. So that's why they will force you to go and study medicine and engineering and whatever, because they really want you to be financially stable, uh, for yourself, number one, and then also to make sure that when they are old, they don't have to keep working, right? They have you to take care of them. So you also need to think of your children. Even if you might think your children are your retirement plan, also have a plan for yourself, so that at least, right? If your children want to spend money on you, it should be to take you on vacation, right? Enjoyment, and not to be jumping from one hospital to another to try to treat any illness. So in concluding this session, before we go into the question and answer session, um, uh, the Bible says that with long life He will satisfy you, right? So we already have a promise that of long life. But one question I keep asking is, what's the value of long life if you do not feel healthy and strong, right? I don't think anybody wants to live a life in pain or feel like you are a burden to your family members and all that. So it's very important that we begin to be deliberate about our health, and pay attention. A big foundation for your health as you age is your nutrition. Let your food be your medicine, okay? So we can make those changes today that will guarantee our health, or guarantee a healthy tomorrow. Thank you very much for listening. I don't know if there are questions. If you have questions, this is the time to ask your questions. Thank you very much. I hope you enjoyed the session. Do we have questions? Okay. If you have a question, you can raise your hand. I think I'll be able to see. Okay, I need to stop. Okay, no. Sure. Okay. Thank you, Fola, for the comment. Thank you very much. Okay. Do we have questions? If you have questions, so I really wanted to spend more time with question and answer. Okay, I see a hand is raised. Mr.
Yeah.
Yeah,
yes. Thank you so much. Can you hear me?
Yes, I can. Go ahead, sir.
Oh, yeah. Thank you. Sorry, I joined a bit late. I don't know whether you addressed this or not.
Okay.
I just wanted to find out
Mhm.
the social media, the social influence, being bombarded with all sorts of things in our generation, news, what we hear all around us. How do we take care of our well-being in the age of living in a social media era? Thank you.
Thank you so much for that question, sir. You know, this session is born out of how would I put it now? Out of the need for us to be deliberate, right? So things do not just happen to you because you didn't prepare, but you prepare for your future, you're deliberate about it. So in this era of social media, you know that a lot is happening online. Number one, what I suggest is you cut down, or you determine when and how much of social media you are letting into your mind. Okay. There's a lot happening there. I don't know if you asked the question in terms of nutrition information, health information, or just general information, right? Where you talk about your mental health and well-being. So if it's both, yeah.
Yes, and the reason why I'm asking is I live in the United Kingdom, and things are quite worse. The things they suggest to us to eat, to drink. There was a time they said we should take plenty of coffee. A year later, they said coffee is not good for you. Then they recommended decaffeinated coffee. Then later they said, okay, take tea. So this year they will ask us to start taking something. Then the next year they will say, oh, it's not, research has shown that that's not good. So we live in a world where we are being bombarded with different kinds of things. Sometimes they will say use Colgate toothpaste because it's got more fluoride. Then later they will say Colgate is not too good for you. So
yeah, I get your point. Yeah, I get your point. So really, it's important that I talk to my colleagues a lot. We also, who are professionals, need to also use those platforms. Even sometimes we have some kind of arguments with medical doctors who are giving nutrition advice that is not correct. Okay, so the truth is, nutrition is individualistic. It's a personal thing, right? There are general principles, right? You remember Mr. Ninja D also, right? There are general principles: moderation, you need carbohydrates, you need protein, but when it comes to at what quantity do I need? Is tea or green tea or whatever, is this good for me? You have to go do a checkup. You need to meet a nutritionist to talk to one-on-one, okay? That I took something and it's working perfectly for me doesn't mean it's going to work perfectly for you. And there are analyses that are going to be done, right? It might just be that my maybe calcium in my body is not enough, so I actually needed that boost at the time. But you have excess calcium, I'm looking for iron or whatever, and you now go and add something that you now skyrockets or makes it over in your body. So please, something I always repeat is, when it comes to nutrition, when it comes to your health, actually in general, do not take information from online or whatever anybody say. Even if you respect them, even if it's me, right? Come to an individual and say, okay, I get to the hospital, I want to see a nutritionist, or book a session with a nutritionist and say, this is me, I'm 50 years old. In fact, I met someone recently who is in his early 50s or so, who does a lot of workouts, right? He gyms, he does a lot of gymming. And he told me that the doctors, his nurse or whatever, said he should reduce carb, reduce this. And I said, if you gym a lot, you need to increase your protein, because protein is to build your tissues as you lose them. As you are burning those things, your tissues are growing. So your brain or your mind doesn't know that you are 50, because you are as active as a 30-year-old. You're as active as a 30-year-old. So you actually should be eating some more protein and not just remove protein from your diet. Maybe a piece. So that's for an individual. I cannot meet another 50-year-old and tell him increase your protein, because that individual might just be driving his car every day to work, and that's it. Walk to the house, to church and back. No physical activity. So in summary, whatever you see online, you can actually do a simple Google check and check for researched, peer-reviewed articles that talk about that topic. If you want to take a step to apply that information to yourself as an individual, then you need to go a further step by getting an appointment to ensure that that instruction, whether it's what to eat or what to do, works for you as an individual. When we take your demographic information and everything about you, we understand who you are, then we know whether that will work for you or not. Most of the time, you cannot just use a general information to start running with it that way. Once they are not under the basic principles, exercise is good, right? Everybody should obey exercise every day, but not everybody should eat 5 eggs every day, right? Yeah. Thank you for that question. I don't know if there are any other questions. Thank you, Kofo, for that. Yeah. Okay, so let me see, where's my somebody's asking, what did he ask? Sorry, just give me a minute to check what that question was. Somebody asked a question about, can we have the can we have your slides, please? These slides are copyrighted. This session will be on YouTube, so you have access to it there and you can use it anytime. And that's the best I could do, really. Yeah. Okay, so I'll just go ahead. So I'd like some feedback. This is the first webinar this year, and I would like to do more, but first off, with one word, if you can describe how this session has been for you, those of us who joined in from the beginning or met us when the session was still on. So just drop a comment on what you think. If some people have already dropped their comments on feedback about the session. And the second thing I would like to add is what topic you'd like us to look at. I'm quite passionate about healthy aging and ensuring that people live healthy lives as they age. So we don't spend our older years, you work so hard all your youth, and then by the time you're getting to 50, 60, you're beginning to manage diabetes, high blood pressure, different things. And all that money that you've worked so hard to make, you're spending it from one hospital to another. I think that can change. I think if we're deliberate, we can live healthy lives. So I'm quite passionate about doing more sessions like this, but I would like to get your feedback on what kind of topics you're interested in, and so that we'll take it from there. Okay? So please drop your comments on in the chat room. Okay, so we have this thing at NutriFit where we're doing free personal consultations till the end of next month, February 29th. Remember, I mentioned if you want a more personalized plan for your nutrition and health, it's better to speak to what do you call it now? To a professional, yeah? So at NutriFit, we're offering that. So you can use the QR code to book an appointment. There's also a link. You can use this link, bit.ly/NutriFit appointment, to also book an appointment. It's free. It's a free 30 minutes consultation, just to get a personal conversation with our nutritionist or myself, any other nutritionist or myself. We're offering this for free till the end of February. Yeah, you can use the QR code also. This mobile number is also available for consultations, call, or SMS. It's not on WhatsApp, so sending a message on WhatsApp would not work on this line for now. If you can screenshot, you can go ahead to screenshot. If not, because I want to just check the other slides. Thank you. Thank you for the comments. I'm seeing them. Thank you. Okay, there's a question from Eunice. What are the critical eating habits or traditional foods that the elderly should avoid? Okay, so Eunice, to answer this question, I need to know who the elderly is, elderly person we're talking about, what is their medical history, right? And what is their activity level, just like what I said earlier. In general, I already mentioned in my session that there are some things you would just naturally have to cut down on. For instance, you cut down on carbs because cut down on protein because your body is you're no more building your tissues, right? We say protein is for building, right? Body building, right? But if the elderly person, I'm guessing that the elderly person you're talking about or referring to here would be somebody who is like 70 and above, right? So their metabolism is now slower, so they need to reduce the quantity of carbohydrates they're taking, protein, because you don't want the liver to do so much work, right? It's slow. It's a slow process for them. It's getting slower, and they don't need all that nutrients at that point, right? They are no more growing. So that's like a general advice. But if you now want to talk about specific food, we need to have that particular individual examined, and then find out what's their need, what are the gaps, and then we attend to those. That's like a general answer I can provide for now. Thank you. I came in too late and only heard your response to the questions. Oh, sorry. Okay, so yeah, Eunice, I hope you're good with that answer. If you want more specifics, just use the appointment thing, and we'll work with that. At least it's free for now. You don't have to pay. We'll work on more details. So I'll have more details about who we're dealing with and what will be needed by the person. Okay, and that's our email there, nutrifitng@gmail.com. For Like Mr. Kofo asked a question earlier about social media, follow the right people on social media. We're on all social media platforms. I'm on Twitter as Oghenefego Ofili, Instagram as NutriFeeds. We also have a YouTube page. You should subscribe there because we talk to experts in nutrition and health, and they provide specific answers to specific questions. You can even drop your questions and we ask professionals these questions. So if you go to our YouTube page, you will see a lot of information that could be very useful to you as regards your diet and health. I really hope this session has been good. I enjoyed sharing, and I look forward to sharing again some other time. Thank you very much for joining.